Hello friends, I am Dr. Pratibha Singh, DNB Pediatric Second Year Resident. Today I'll be discussing about a very special syndrome which I happened to came across in my second year of residency few days back. It is known as a Treacher's Collin syndrome. The patient was a neonate who was a diagnosed case of Treacher's Collin syndrome and who mainly came with complaint of feeding difficulty. So because it's a rare syndrome, because I've seen it once in my 2 years of residency, so let's study about it, what are the features about it, so that we can remember it. Let's begin our short discussion with Treacher's Collin syndrome. This is Treacher Collin's syndrome. I'm referring the source from Nelson 22nd edition. This syndrome is also called as mandibulofacial dysostosis. Nelson has given another very fancy name for it, which I don't even know how to pronounce it correctly, but I think it's French-Shetty syndrome. French-Shetty. I hope I'm pronouncing it right. French-Shetty syndrome. What is this syndrome? It is an autosomal dominant syndrome which mainly affects the face development. And face development, this syndrome arises from defect in first and second branchial arches, which we used to study in anatomy, that embryology, all part of it, just for remembering it, that it's a defect due to development of first and second branchial arches. This syndrome has some characteristic facies which we will be discussing here. What are these facies? There are two diagrams which I have taken from Nelson. Not Nelson, it's from Wikipedia, because as you all know, due to professional privacy, we cannot disclose that face of a patient. So this is a very beautiful image from Wikipedia which is showing the characteristic features of this syndrome. As you can see, at first appearance there is a problem. The eyes are in a downward sloping manner, the maxilla is underdeveloped. So this can have in eyes, these patients have downward sloping palpebral fissures. They can also have coloboma of eyelids, especially lower one. Coming to the cheekbones are small and like underdeveloped, which is called sunken cheekbones. The nose, this characteristic, not a characteristic, but the nose is quite a beak shaped nose, and these patients can have choanal atresia as well. The patient I saw had unilateral choanal atresia, so yes, that can also be present. And you can see here in this image is showing very good features, like we can see there is downward slanting of eyes, the nose is a quite beak shaped nose. Coming to ears are not developed properly, so there is microtia or anotia. In the external ear as well as middle ear is not developed properly, so these patients are having conductive hearing loss. And so they may require some hearing aids for their convenient life, for their development. These patients are having microtia or anotia. Coming to the mouth part, Their mouth is large. You can see in this image, large mouth. The mandible is hypoplastic. It's a small mandible, small jaw, due to which the teeth, they do not get enough space. So there is also crowding of teeth seen. Small mandible, crowding of teeth. And another important thing is that palate. When it comes to palate is high arched and cleft can be present. So these are some characteristic features of the babies or patients with Treacher-Collin syndrome. The cheekbones are not developed, so the orbit doesn't get proper place. There is downward sloping of eyes, downward palpebral fissures. Nose is beak shaped. There can be choanal mouth is large, mandible is small, so there is crowding of teeth. Palate is high arched and there can be cleft palate also. Coming to ears, there is microtia or anotia. These are some features. Another interesting thing you can see here in this image is, I'll show it with different color. Like there is this kind of pattern, a hair growth is seen coming towards this cheekbone. Hair growth extending to cheekbones. This is also very characteristic. So this is a very short and sweet syndrome, Treacher-Collin syndrome, and it is a good syndrome. We can say it's a good syndrome because there is these patients have normal intelligence. Normal intelligence. There is no retardation of growth, development or milestones. This is a good thing that they have normal lifespan like others. It's only their face which is getting affected. The treatment for these patients are mainly surgery, which is a reconstructive surgery due to cosmetic reasons. Reconstructive. There can be palate reconstructive surgery, mandible surgery, maxillary surgery, ear surgery, and they have good outcomes because rest of the development of these syndromic child is good. So this was a short and sweet syndrome, Treacher-Collin syndrome. Thank you.